I'll make a motion.
Got a motion by Donna to approve the minutes, got a second? Second by Randall, all four?
Yep.
All four. Okay, financial report,
In operating account, we have $1,253,961.33. And I cut the rest of it off.
Cut the rest of it off?
Yeah, let me, hold on.
It's right here, Charlotte, the CD, it's on the next page.
It's on the next page.
It should be the same.
The CD is $2,023,449.14.
Yeah.
And then the payroll account is around $12,000, what we normally keep in it when we're not expecting a payroll. Sorry, I tried to make the numbers bigger for you guys, and I accidentally cut off the.
That looks a lot.
And then, of course, the construction fund is still the 4.6 million. The other report is in there as well, that you guys had asked for a complete month.
Do we need to go ahead and move that other $1.4 million out of that now instead of waiting? Or what do y'all think? Is there's no penalty with moving it, is there?
Let's wait to make sure we get this value engineered down.
Well, I mean, I'm just saying, I'm just asking you, is there a penalty?
Well, we can do it next month.
We're gonna miss, what, 1 month's interest? or
I'm good
something?
with it, I mean, I'll just check
Say
it.
that again.
Ain't there 1 month's interest
There's
penalty?
something about us adding money to the bond money. So we just felt like it'd be okay to leave an operating
Okay.
account to
Right.
pay out.
Okay, that makes sense.
No, he's talking about the taking the
CD
money
Taking
out
out
of
the
the CD.
CD.
The CD,
Moving
moving
it
it over,
operating.
Taking the million out of the CD.
make it out of the
To
CD.
the
over.
operating?
No, over to your, construction.
Construction, but we don't need to do
We
that
don't.
just yet, I don't think.
Okay, that's fine. I'm just curious to see, cause I didn't know if there was a penalty or what. Is there a penalty? That's what I was thinking.
Well,
Somewhat.
no, we've been told there wouldn't be.
Oh, okay.
By the bank.
But the interest, I think, is better where it's at.
Yeah, that's what,
that way
right,
we're
yeah.
going.
Yeah.
I'm good with it. I was just.
Until we need it. You know, we may not need that
Right.
until,
I
down the
agree.
road.
yeah.
April or May.
Right. Okay, anybody else have any questions on the financial? Okay, we'll move on to the next one, elevator service agreement.
Looks like that elevator will take care of the financial, I'll lift it on up there.
Well, on our elevators, is it gonna be in compliance with what we're doing from this point on, or is it just gonna get us through to a construction?
No, the elevator's not included in the construction.
Well, I mean, but we're gonna be good and all that when we start.
Unless something else
Like
breaks,
something
right?
breaks.
Yeah,
I
but
mean,
it shouldn't. I
when-
mean,
Well, it's
Yeah.
gonna be up to standard, is what I'm saying.
Oh, yeah.
Okay.
Oh, yeah, yeah.
We-
And that's what I wanted to, when I emailed him back and told him that they received the bid and, but we decided not to go with the service contract, and he asked me why, because he offered a discount with that. I told him that we basically didn't be locked into 10 years service agreement. And so he sent back a different proposal that he would still give us the discount if we wanted to do a 5-year. And so Charlie and I got to looking at it, and we have to do 2 tests. We have to do a fire service test on the elevator every year, and that costs $497.50. And we have to do a pressure test annually, and that costs $738.50. So that equals about $1,235 annually.
Well, does that include it in his? Does he
It
do
does
that?
include that, and it would be cheaper to do a
That's what I was
5-year
gonna say,
service
it'd be
agreement.
cheaper to do
Because
that.
when it's all said and done, what we would owe him then would be $1,120 a year annually for 5 years. And all those tests
We'd
would
be
be
better off doing
included.
it that way.
Yeah, so
Yeah.
we thought that would be a good,
Does the state inspect it every year?
Yes.
yes,
Mhm.
yes.
And that also includes quarterly maintenance.
Quarterly maintenance,
Mhm.
yes.
Do we need a motion
I'll
on
make
that?
a motion, we
Cheaper
go that way.
than paying out. the
Right.
I'll second it.
Okay, we got a motion by Randall, second by Frank to go with the new policy. All four? All four. Okay,
We'll get that in.
let's see, administrator's reports next.
Okay, our census is 92, struggling a little bit. Our home delivered meals is staying very consistent, 40, 41. The new thing I want to share is, I've shared a little bit about the quilts portion of our TennCare reimbursement, the satisfaction surveys. Well, we've been allowed to do those, nursing facilities have, on our own for the last couple of years. And off of those, satisfaction surveys, we would come up with performance improvement projects and culture change and different things based on what, the feedback we get. And we've done very well with those. However,
We're gonna
TennCare.
stop it.
TennCare has decided now to, contract with a company to do them statewide. So,
Well, I bet you they lose money statewide.
So they
They've got
will-
a buddy that they want to give it to.
now they will pay someone to do our surveys. They will send the information out. They'll send the resident surveys to us and the, staff surveys to us, and we will distribute those, but then they will send them back anonymously. And so then they will look over it and they will give us the data, but they will mail directly to the families for their satisfaction. So we have sent out this week letters to all the families about what they're about to receive and what it means, and it's part of our reimbursement. So it's very important
That they fill them out.
that they fill them out, you know, and we get the feedback and we improve. Here's the thing, we still yet have seen the questions on the surveys, so we have no idea what the questions are, what they're asking. And we won't see them until they send them out to the families and we get them for the residents here and, for the staff. So, just so you know, that's kind of out of our hands, and I've got some information about it for you guys. This is the campaign, we're listening. They give us a lot of information to share with the residents and the families, and we've got bulletin boards up, we're sending out flyers, like I said, to the families, we're talking to our staff about it.
All it's done is costing you more money, because you're having to pay a staff person to send these out, and then if they don't send them in, you're gonna have to call the family, so you're winding up
We're
costing.
gonna have to talk to the families a lot, which is what we do already, but
Right.
this is just added work. If they're telling us that something's not right, we can fix it right then. See, that's the thing about it. It's a time-consuming thing, and it takes more money to pay these people than it does to send to the nursing facilities. That's the bad part that I see.
Yes,
But we have to jump through the hoop, and so there we are.
So if we don't do it, we don't get our Medicaid reimbursement, is that
Well,
right?
it's part of our Medicaid reimbursement
Right.
now,
Okay.
is that we improve quality.
Which,
They'll still get it, Darwin, it's just that, their reimbursement rate goes off what these
Most of it.
satisfactions are.
if they're not
That's a
satisfactory,
portion
they
of
can
it.
deduct it.
Yeah, that's a portion of it.
Yes.
Yeah, they could take a Wilmington deduct
Well,
it.
they'll send us back the data, and then, this first time is like a benchmark. So they'll set a benchmark for this first time, and then they'll see, is satisfaction getting better, is it declining? You know, what are we doing, what are our facilities doing? We've been very blessed so far to get the highest tier that you can get in the Quilts program. And so, I feel sure we still can. We just need families and residents and staff to understand it's.
All of them needs to
It's
respond to
immediate,
it.
but
Yes, yes,
You
we
won't get
need,
them all to respond, probably.
No.
it's very important,
They won't.
so,
Okay.
anyway. But I've got some information here, if y'all would like a letter from TennCare,
I'd like one.
to read about it. Anybody else want one? No? And this is the letter that was sent out to the families.
Residents and families, okay.
Okay.
It's just harder to get our TennCare reimbursement,
Mhm.
it just is.
Well, they don't particularly want you to get it.
We gotta get it,
Right.
so.
Well, if we stay in business, we have.
Yeah, we gotta get it, it's just, it's the same thing when they started home community based and the MCOs.
Yeah.
You know, used to, we dealt directly with TennCare. Now you got MCOs, you got Blue Cross Blue Shield, AmeriGroup, United
Mhm.
Healthcare, So they're getting pieces of the pie to help manage it. Now, these people are getting pieces of the pie, which takes away reimbursement to nursing homes.
Yep,
Yes.
Right.
There's no other way to say it.
that's the only way they're gonna pay them.
Okay, you got anything else, you,
That's all
Don, you got anything?
Yeah, what is the, policy for cell phones here? With staff and with residents, families and residents, whatever?
The policy for our staff is do not bring your cell phone in this building.
Okay.
Yes.
Okay.
Residents are allowed to have their cell phones. I can't do anything about family members. I have had to have some discussion with some family members about taking photos of other residents when they are not supposed to be doing that. So,
Due to HIPAA law?
yes. Yes, you can take all the photos you like of your own family member, but you cannot take photos of anybody else's.
Okay. That's it.
Don, you got anything? Frank?
No.
Randy?
Yeah.
Well, spell it.
Shut up, Trump. Just had a patient here, passed away here a while back, a week or so ago, well, December the 20th. Marcia Tidwell. Been treatment area,
You can talk about patient information if you want to in this meeting, but I won't.
but, her and her mother were good friends of mine. And her mother called me and told me that she appreciated the good care that she got here. So,
Well, I would just say don't bring up patients' names in a meeting.
but that,
That's what
you
I
know,
would say. I don't mean to be
Yeah.
ugly about
It
that, but
don't
when
matter
we talk
because,
about
you know,
HIPAA violations,
that's,
good or bad,
and we hadn't had a meeting since then, so I want to let you and the board know that her mom said that she got good care.
well, we appreciate that.
Okay, what time, when y'all set up next meeting for next month? What's good for y'all?
Well, the next meeting, regular meeting for this will be the second, 14th,
Right.
which is Valentine's Day.
Well, that's why the reason I said that.
And then we're probably gonna have a meeting before then, hopefully.
No matter me, don't risk it.
A couple meetings before then anyway, so. Is the 14th good with everybody? Good with you? Good with me? I beg your pardon?
14th.
I ain't got no
Maybe, but
problem.
everybody
Yeah.
else.
Okay.
I ain't
What
expecting
if
no.
everybody else has got plans? It's Valentine's Day.
Well, go ahead and do 'em.
Yeah, I mean, you
That's
do
good
good
with
with
me,
you.
14th.
I mean,
Yeah.
It's
it's
not
not.
Valentine's Day, it's the day after my birthday.
Oh,
you, Randy?
you might be out of
That's
town.
good with me.
I think I will. I think I'll go out of town, Donna.
Yeah.
14th's good with me if it is
Good with
anybody.
me.
Oh, I don't care, I'm just saying, you know.
Oh, okay.
14th
I
then.
accept all birthday gifts.
14th.
You said that wasn't your
February
birthday?
13th.
That's a bad day, especially when it comes on
It's a
Friday.
great day.
14th
Especially
then.
1972 was a great
And
year.
then, you're
I don't
gonna
know about that.
let us know when we're gonna try to have a couple of meetings before the end of the month with, Mid-State and Joy.
As soon as they can get
Okay.
things together. Right?
As soon as they can get us something
What
to
we've
talk
got.
about.
This month, we'll have a couple more meetings?
Well, I don't know. I mean,
Well, when
Well,
they
the
get
reason why I
something-
brought that up is that, the 14th, 15th, and 16th is out for us. Most
Yeah.
everybody here, so.
14th.
15th and 16th.
Of January.
Of January, yeah.
Yeah.
We have meetings 3 days in a row
I don't
next
think they'll
week.
get back with anything. And then-
I may not, I'm just letting everybody know not to schedule
Might
anything
get it.
that week,
20th or 25th or somewhere in there.
so.
Might,
Maybe, but I just wanted y'all to know we couldn't do nothing.
but we
this
need
week.
to act on it as soon as we can, so
Right.
we can get it going.
Yeah.
I mean, we could do it on the 17th if that came up, but nothing before then.
I don't see them having anything in a week though.
They might not.
No,
But I mean, they might, but
might have it, first week of
I mean,
February.
they may
I hope
already
before
know
then.
what they can do, cause they know we was gonna do it, so they may already have it. You know,
And do we
they may
need,
already have it.
since they're gonna be short, do we need to call them work sessions? These quick down and dirty meetings, or how we gonna look at that, get them set up? Cause if we don't do them work sessions, then we'll have to run them in the paper for 14 days.
We
10
have to
days.
run a work session too.
Yeah, it need to be work sessions, I think.
Do you have to run the work session that long?
You have to run
You
the
don't
work
have,
session.
you don't
I
conduct
don't
business?
know anything about
7
14
days.
10 days, you have to write the paper for so many days, how many days?
7 days.
7 days, okay.
7.
I thought it was,
It's not like a regular meeting.
no, it's not a meeting, it's a work session, you
Yeah,
don't
I
vote
know,
on
work
anything,
session,
so.
sometimes work sessions don't even have to be running.
That's what I was talking about,
You
yeah.
know,
That's the reason I was
it would
wondering.
be better if you did, you know, if you could,
But-
I think.
Okay, well, I'm just trying to make sure we can expedite when that gets ready to go, so, that's all I was thinking.
I'd look for them to have something the week of the 21st, I don't know.
Amen.
I'm just guessing.
Well, you can let us know.
I'm just guessing what I'm hoping.
Just keep on guessing.
Just a
Well,
guess.
if we do have to run it in the paper, so many days, we need to set a couple of work sessions just in case they do, because we don't want them to say, and
Exactly.
come Monday, say, okay, you know, we can have something ready by Friday. But we can't, because we're gonna have to wait
Right.
7 to 10 days before we can get them. Maybe, so we ought to schedule a couple of work sessions whether we have them or not.
So let me be clear what we intend to get out of the work session. What do you want to get out of a work
So
session?
what, the value engineering?
You can do that during a work session, then vote on it at your next meeting if you have to. That's what we're gonna do, you know, that's the plan, is to
Yeah.
get with them and try to value engineer, so.
See what we can come up with.
So
And
the
then-
week of the 21st, what would work?
Any day that week, I think. But Frank,
Any
you got
day
your
except
calendar
Friday.
up?
I ain't got it with me, it's out in the car.
I mean, we don't have no other county meetings
Not that I
week.
know of.
No, we don't.
I think we got them all the first 2 or 3 weeks
Right.
of the month.
But I mean, you know, we'll have to get together and work on it and then come back and vote at our next meeting or something, you
And
know.
have to make agree on it anyway. If we
Right.
can't vote on it, we can agree on it.
And go, yeah.
And bring it up to regular meeting.
Yeah, cause we can't vote on anything in a work session.
No.
They just tell us what they're doing, gonna
Yeah.
do.
Well, we can
So the
make up our minds.
You wanna do tentative dates?
Sure,
Week
I'm
of the
good
21st
with
and the
that.
next week?
That's fine with me, the 21st will be,
That'll be a Monday.
a Monday, so we'll do it for the 23rd.
Are you
or
talking about
24th.
January or February?
January.
Do what?
That's MLK Day.
January, yeah, it's, well, I can mix up. 23rd and 24th would be good. If that's good with everybody else,
So the 21st is a holiday?
yeah, that's Martin.
Martin Luther King Day. Martin
What
Luther
did you
King
say?
Day.
What did you say?
Martin
All
Luther
right.
King Day. We on.
When's
Yeah,
Frank
I know,
Martin
right?
Day?
It's done been.
Oh, okay.
I mean, we could look at
Yes,
the
yes.
24th or the
No.
31st.
Some people
those-
work for a living, Frank.
Those dates there are open, and then,
I know, I do.
our next
I
meeting will be,
think, Darwin, I think probably right in here. 'Cause
Well, I do,
I mean,
yeah.
I think he shot some dates of this week, this
Oh,
coming
yeah.
week, to them. And it's gonna take about a half a day, I think, for
Okay.
them to
Get
kinda
together.
hash
Out
some things.
days.
And
Do
then
you
I
think what
think
days?
Mid-State will have to get with kind of their subs a little bit. I think later this week or this week.
the week of
This
the
last
25th,
week.
I mean, the week of the,
Well, we could
Down
do
here.
Thursday the 24th.
she's talking the week of the 28th, is what she's.
Well, I think probably start with the 24th and something down
We
through there,
can
but I
set
don't
tentative
think.
dates, it doesn't mean we have to.
Yeah, I don't,
Meet,
I just think
if they don't have anything.
earlier in that week is gonna be pressing.
Well,
I don't think they'll have it, no word.
Why don't we just do one the 24th and one, and if you have to do it in the paper, do one 24th and one 28th, and then if the 24th is not ready, then we've already got in the paper for the 28th. Put both of them in the paper, 24th and 28th both.
You don't have to advertise a work session, do you?
Well, in
I
case we do.
didn't think so, but,
No. I don't.
You're not conducting business, really. You
No,
don't
we
vote
can't
that.
vote on nothing.
Well, I don't think we're really gonna have to vote on anything anyway, to be honest with you, so it don't matter.
But we
That's
do
really
need,
gonna be to vote on.
but we do need to get together and agree on it, though.
Yeah.
Yeah, we
That's
can agree on it,
the
I don't think we'll have to vote on anything anyway, they're just gonna propose some things to take in, take out, I mean, you won't need to vote on it, no, man.
We
Just
will
agree.
now.
I mean, I think the vote is take it from 6.2 to 6 million.
yeah.
Right.
I mean, I think
That's-
that's.
Yeah.
6
That's what I'm-
That's where
Same
we're
as
at.
6-3.
I'm done, right?
Yeah.
But the
So
work
we're gonna
session,
set up a
You said the
work
24th
session
and the
for
28th.
24th
That's
and
what I said.
28th?
It'd
Well,
be
when's the
24th.
what day's 28th on?
Monday.
But the way I understood him,
But
the
we
work
have one
session
more
would just
meeting.
be,
Right.
they'll give us a
Right.
list of things to take out, and the board will decide what to take out,
Was it?
and how much it'll cost. And that's my understanding of what they'll do. It may be $500,000 worth of things, and the board will decide which things you wanna take out to come down to the $60 million.
So you're saying advertise for the 24th and the 28th?
If we
And
need
if
to.
24th don't work, we'll just cancel that one and do it on the 28th.
If we need to put it in
If
the
we
paper.
have to.
I check with,
I'll
who
check
would need
with
to.
Connie.
Yeah,
Won't be
check
there,
Connie.
it'll be Monday before she's back.
Oh,
Who?
she don't.
Got it, okay.
Well, Teresa should know.
You
Teresa's
just-
one
yeah.
puts them in the paper anyways.
Yeah.
Yeah.
If we don't need to put it in the paper, that's fine, but if we do, go ahead and put them in.
And you want Joey present?
Well, we'll have some
Well,
questions.
if they got
Yeah.
something together, there's no. use
If
in
they've got
making-
it together, what they're gonna be taking,
Well, what they
suggest we might
recommend.
take out. If
Yeah.
they got that together, we need to,
I'd like to,
both of them here probably.
Yeah, if they've not got it ready to do anything, there's no use meeting anyway.
Uh-uh.
No.
No use having a meeting if they're not ready.
If we don't have to put, I don't think we have to put it in paper, but if we don't have to put it in paper, we can just call everybody and get them over here after we know what they can do.
Excuse me.
If they're not ready, there's no use meeting.
Uh-uh.
But I was thinking we had to put some work sessions once in the paper, so.
I thought we did too, but maybe.
But Teresa will know. If not,
Shame,
call
we can't remember
Andy,
all
he
that.
can.
It's too much.
Paper.
Well, it's just too much we have to keep up with. We don't do it enough to remember.
Well,
We've set them in plenty of time.
if we're done, I make a motion we adjourn.
Got a motion to adjourn.
I second.
Got a second vote.